All right, I think we can go ahead and begin. Thank you, everybody, for joining today. This is our training webinar in advance of Washington Days for those of you who have been to the event a couple or more times before. If you don't know me, I'm Nathan Schaefer. I'm the Senior VP of Public Policy and Access here at NBDF. During our 30 minutes together, you're going to hear from me. You're going to hear from our colleagues within the communications department at NBDF. And we're going to spend most of the time with our friends from the Artemis Policy Group, who are going to be walking us through the policy issues and the asks that we will be focused on during our time together in Washington on March 5th to the 7th. Next slide, please. If you're not familiar with NBDF, I assume you are because you've been to Washington Days a few times, but this is our mission and some of our key areas of focus. One of the things I want to stress here is that our mission is not only to serve the bleeding disorders community, but to ensure that all members of the community are able to thrive where they live. And that's where you all come in with our efforts at Washington Days. These are our strategic imperatives, and the one I want to stress that is most relevant to our advocacy efforts is access. Access to equitable and affordable care for all patients of the bleeding disorders community, regardless of their demographics or their zip code. And that's why we will yet again bring together over 400 advocates to Washington, D.C., March 5th to the 7th. I should let you all know if you've got questions during our time together, put them in the Q&A function at the bottom of your screen. We will either answer them live, we can type in an answer, or we'll have time for Q&A after we walk through the brief presentations. I want to say thank you very much to our sponsors for making this event a reality. We wouldn't be able to do this without you. And if you've been to Washington Days for 15 years or more and you want to be there every single year, we'd love to see you again next year. And these are the dates for Washington Days in 2026, March 4th to the 6th. So with that, I am going to turn it over to my colleague, Jasmine. I'll be back later to answer questions, but want to say thank you all for your willingness to come back to Washington, D.C., and for taking the time to join us today.
Thank you, Nathan. So my name is Jasmine Cade. I'm the communications specialist here at the National Bleeding Disorder Foundation, and I'm excited to go over our Washington Day social media toolkit. So it's designed to help spread the word, spread awareness, and also for us to celebrate this important day of Washington Day. Within our toolkit, you'll see that we have sample posts, graphics, and hashtags. And then just to briefly go over them, you can follow us at NBDF on any of the social platforms such as Instagram, Facebook, LinkedIn, X, and YouTube. And then for sample posts, those are captions that we've already created for you, so you can always use those or switch them up just a little bit. If you are posting, we do ask that you tag us in any of them. Specifically on Instagram, you can find us at NBD_foundation, and then you might get featured and have your post put out there. When you're posting with captions, we have our hashtags here. For this year, it's hashtag Washington Days 2025 and hashtag NBDF. So again, that gets coupled with your captions that we provided for you there. And then even if you're posting on stories, you can use the hashtags when posting on stories. And then where it states images to share, if you click that hyperlink where it says download images, it will take you to a Dropbox that has all of the pre-made graphics for you. So you can use the graphics there alongside with the already made captions and then completing it with a hashtag and tagging us on all of your posts throughout leading up to Washington Day and while you're currently at Washington Day. Thank you.
Hey, I'm happy to just jump right in if that's helpful. Hi, everybody. My name is Joanna Gray. I am with a firm called the Artemis Policy Group, and we have been partners representing NBDF in Washington for many years now. This will be my 18th Washington Days. It's one of my favorite days of the year, and I am super excited to see so many familiar names in the attendee list, and that we'll have so many veterans joining us in next week, 2 weeks, 2 weeks. Next slide, please. We're going to just briefly give an overview of the 3 issues that we will be talking about during Washington Days this year. As all of you guys know as veterans, this is just the first taste of the policy briefing. We'll chat more when you come to DC. You'll get copies of fact sheets and talking points and all that good stuff. But of course, we want to hear any questions that you have now. As we're going through today's webinar, please go ahead and put any questions or comments in the Q&A box, which I think is in the bottom center of your Zoom screen. So our issues for Washington Days this year, we will have 3. The first is protecting and funding the federal bleeding disorders programs that support research, comprehensive care at HTCs, and blood safety monitoring. We know these programs are really important to people living with bleeding disorders, the HTC network, and we want to make sure that all of their activities can continue. We'll be talking again about a piece of legislation called the Help Copays Act, which is trying to ensure access to needed medications for people with bleeding disorders and lots of other folks with complex and expensive chronic conditions. And then our third ask is we are asking Congress to reject healthcare cuts, which can come in a couple different ways. There's a big debate happening in Washington right now, and we are trying to protect Medicaid, very important insurer for the bleeding disorders community, as well as tax credits that lower the cost of premiums for lots of people on the ACA marketplaces. You can see here this kind of snazzy graphic from our friends at WFH. As you may know, World Hemophilia Day this year, which is April 17th, has a theme really highlighting the experiences and stories of women and girls with bleeding disorders. Women and girls bleed too, as you can see here. And so throughout all of Washington Days, we are seeking to highlight the stories and experiences of women and girls in our community. And we will actually be coming back to Washington for a smaller congressional event on April 17th, really focused on women and girls. But it's kind of the theme for the whole year, and so wanted to start that with Washington Days. Next slide, please. So as all of you know, before we get to the asks, meetings always start with introductions. You can mention that March is Bleeding Disorders Awareness Month, and then it's really an opportunity for advocates to tell their story. What does it mean to live with a bleeding disorder that you do or someone that you care for? Maybe you work at a hemophilia treatment center and you care for lots of people with bleeding disorders. We know that the foundation of all of the policy asks that we'll all talk about in just a minute and that you'll cover in your meetings really rests on the personal connections that you can make with policymakers. And so that comes from telling your story. And again, we, in this bottom corner, will have advocate Mad Libs, a hard copy piece of paper on the desk, on the tables during the Washington Days training on the Wednesday night to help guide people in telling their story. So the first act, as I mentioned, protect and fund federal healthcare programs. As many of you know, there will be, there are a number, I'm distracted by the Q&A box, I'm sorry, I'll close that. There are a handful of programs at federal agencies that really focus on our community. We're really lucky that we have public servants really dedicated to us, and we want to make sure that they can continue. As I'm sure many of you know or have read in the paper, a couple weeks ago, the Trump administration briefly froze grant payments to federal grantees across the government. They have unfrozen the grant payments now, but have made a long list of federal programs that they are scrutinizing to assess whether they should continue. And we really want Congress to join us in advocating for these programs so that they can continue. Next slide, please. Again, there are three particular agencies and programs that we will be highlighting. The first one is at HRSA, the Health Resources and Services Administration, provides funding that helps to support HTC services not typically covered by insurance. They also help to disseminate best practices and ensure the highest standard of care in the HTC network. As HRSA grantees, that's also how HTCs have access to the 340B drug discount program that allows them to support care for all of the patients at their center. HRSA is a little more of an under-the-radar federal agency compared to the next one, the CDC, obviously much in the news in the past few years. But at the CDC, there is a division of blood disorders that, again, is focused on blood disorders, provides funding for surveillance and data collection at HTCs, as well as bleeding disorders education for nonprofit organizations like NBDF and HFA, and really important safety monitoring for blood and blood products. Finally, the National Institutes of Health, NIH, is our nation's premier research agency, funds billions and billions of dollars in research in all kinds of disease areas, scientific areas. They have funded a number of really important studies in bleeding disorders and have done a lot of work lately focused on inhibitors that we know is one of the most complicated complications of hemophilia today. So our bottom line, next slide, please. We want these programs to be maintained. These are relatively modest federal investments that are really important to, in these programs that are really important to our community. And we know that the moderate investments pay off in terms of supporting the HTC network. We know folks who go to HTCs have better health outcomes and lower healthcare costs. So I think we're in a political environment right now where there's a special interest in lowering healthcare costs, lowering federal spending. We can make a case that supporting HTCs and these federal programs really does contribute to that goal. We also know, tying back to women and girls with bleeding disorders, too many of them have been excluded from care. And as we're calling on HTCs to serve more patients, including women and girls, we need to make sure that HTCs have sufficient capacity to do that. Again, we need to make sure these programs can continue. Okay, next I will pass the mic to my colleague Leslie, who will talk about the Help Co-Pays Act.
Yes, hi everyone, Leslie Brady here, getting ready to attend my third Washington Days, and I'm very much looking forward to it. And I will answer that question in the Q&A about reintroduction of the Help Co-Pays Act in just a minute. So you are likely all familiar with this ask as returning advocates. We've asked for it for the past few years, but we will again be asking for support for the Help Ensure Lower Patient Co-Pays Act, Help Co-Pays Act for short. And as you know, this addresses two important issues to the bleeding disorders community: copay accumulator adjuster programs and copay maximizers. And we will just briefly refresh ourselves with what those are. So next slide. As a reminder, copay accumulator adjuster programs occur when health plans accept copay assistance dollars, but then do not count them towards a person's out-of-pocket maximum or deductible. So we all know that treatments for bleeding disorders are incredibly expensive, and folks often have to turn to manufacturer copay assistance to help afford those treatments. And if your plan has a copay accumulator adjuster program, they allow you to use that manufacturer copay assistance and they take that money, but then they don't count it towards your out-of-pocket maximum or deductible, making it very hard for that individual to continue to afford their treatments. Copay maximizers occur when a plan says that a covered drug is not an essential health benefit. And when a covered drug is deemed to be non-essential, even though we all know it is indeed essential, the insurer can set cost sharing as high as they want. And then they don't count, again, any of the copay assistance towards the patient's deductible or out-of-pocket maximum. When a drug is considered to be non-essential, it doesn't have to comply with the patient protections currently in place in law. And then that allows the insurers to set cost sharing high and forcing folks to turn to manufacturer copay assistance, but then not counting it again towards that cost sharing. So what's the impact on the bleeding disorders community? These practices make it so much harder for people to access needed medication and can actually result in someone reducing doses or stopping taking medication altogether. And you all know very well that for the bleeding disorders community, this could lead to severe complications such as joint bleeds or damage, more visits to the emergency room, and missed days from school and work. This problem is not unique to the bleeding disorders community. It impacts other chronic disease states with high-cost medications, cancer, multiple sclerosis, HIV/AIDS. And for that reason, NBDF is part of the All Copays Count Coalition, and in fact, we're on the steering committee. And this allows us to do more and be louder on this issue. The ACCC elevates the Help Copays Act both at the federal level and the state level, and is continuing to work on this issue this year. So what exactly does the Help Copays Act do? It would make two important policy changes. First, it would clarify the Affordable Care Act definition of cost sharing by ensuring that payments made by or on behalf of the patient counts towards their out-of-pocket maximum or deductible. And it would ensure that any prescription drug covered by a health plan is considered to be part of the essential health benefits package, so that any amount paid in cost sharing counts towards the patient's deductible and out-of-pocket maximum. And now to get to the question of reintroduction, as you likely all know, with each new Congress, every piece of legislation that did not pass in the prior Congress does have to be reintroduced. We do not yet have the Help Copays Act reintroduced. We will have more information in 2 weeks when you are in DC. We are hopeful that we will have at least one of the chambers reintroduced. But again, we will have more information for you in 2 weeks. And I will add, even if it is not introduced, this is still a worthwhile ask because it will be coming out soon. So more to come in 2 weeks when we see you in DC. A quick update on the state level. As you all know, this is also something NBDF advocates for at the state level. 21 states, DC, and Puerto Rico have all passed laws that limit the use of or ban copay accumulator adjuster programs. But laws at the state level only impact certain private insurance plans. So we need the federal legislation to cover all private health insurance plans and to capture those states that have yet to take action on this issue. I will now pass it off to Miriam for our third ask.
Thanks, Leslie. And hi, everyone. I'm Miriam Goldstein. I will be attending, I don't know what, Washington Day, because while I'm the newest member of the Artemis policy team, I have been around bleeding disorders in various capacities for 33 years as a hemophilia mom. So I am happy to talk about our third ask. We have tried to make it as clear and straightforward and compelling as possible. Our ask is no healthcare cuts. But that's really a two-parter, and so we need to unpack it a little bit. Where the two parts are, we're calling on Congress to preserve Medicaid against harmful funding cuts and additional red tape. And as our second part, we're calling on Congress to act to extend tax credits that lower the cost of marketplace premiums for millions of Americans. So let's dig into the Medicaid piece of that. Just to to level set the table, some background. Medicaid is a public insurance program. It's a federal state program with the states administering it and setting certain rules within broad federal guardrails or borders of what they can do. And the federal government kicks in a lot of money. The federal government basically makes an open-ended commitment to the states to meet a percentage of state spending ranging from about 50% to about 75% based on how rich your particular state is. Medicaid goes by different names in different states. So in your state, it might be called Husky Care or something other than Medicaid. But it is the single largest insurer in the US. It insures almost 1 in 4 lower income Americans, about 4 in 10 births. And over the past 10 years, 40 states have adopted Medicaid expansion, which means they have expanded their Medicaid programs to cover low-income adults, regardless of disability or parenthood status. This was an option that became available with the passage of the Affordable Care Act, and so now 40 states have expanded Medicaid. So that's its national importance. For the bleeding disorders community, Medicaid provides essential coverage for about a third of our community. And so for a large number of our fellow bleeding disorders community members, this is what provides them access to the medication they need, to their doctor's visits, to their care coordination. It's what makes it possible for many in our community to preserve their health and lead healthy lives. Next slide, please. There are some really present threats to Medicaid right now as we speak. There is a large tax and spending debate going on in Washington. And as part of that tax and spending debate, Congress is looking for ways to save money. And one of the places they are looking to save money is by making major Medicaid reductions via a suite of policy changes. Some of those policy changes are outright cuts to Medicaid. And those can take different forms. It can be just a cut, or it can, sometimes you'll hear talk of per capita caps and block grants. Those are changes to the Medicaid financing structure where the federal government would no longer maintain that open-ended commitment to keep pace with state funding, but would set a hard cap on what they pay. There are proposals to change the federal matching percentage to lower it from 50 to 40% or 75 to 60%. There are proposals to change the federal matching percentage for the expansion population. So some of these changes would cause states immediately to drop the Medicaid expansion. There are 9 states that have trigger laws, and if some of these funding cuts went through, the states would immediately drop Medicaid expansion. Other states would follow, even if not immediately, because the net impact of any of these changes would be to shift large costs to the states, to pull back the federal financing and say, states, you are bearing these costs. And the states would inevitably cut who they cover and what they cover. They would cut eligibility and they would cut benefits under their Medicaid programs. And that's an incredible risk to our community. There's another aspect to the Medicaid debate under discussion right now, and that is adding red tape, work and reporting requirements. This is kind of dressed up as a reform, but you shouldn't be fooled. This is, in fact, a cut. In the states that there are only 2 that have gone forward with work and reporting requirements so far, requiring patients to work a certain number of hours and navigate state bureaucracy to report those hours, there were massive coverage losses. So either funding cuts or additional red tape pose a risk to coverage, and that's something that we oppose as representatives of the community of bleeding disorders. Next slide, please. So I said it was a two-parter, and our second part was the premium tax credits. And again, I need to back up a little bit here. The ACA marketplaces are a really important source of coverage for millions of Americans, including many with bleeding disorders, especially for people who don't have access to health insurance through their jobs and who don't qualify for Medicaid or Medicare. In 2021, in the middle of the pandemic, Congress, when it was incredibly important to keep people insured, Congress made marketplace coverage more affordable by both increasing the generosity of tax credits that help pay for premiums and making those tax credits available to a bigger pool of people. And because of those enhancements to the premium tax credits, the share of people insured by the marketplace has doubled since 2021, and premiums have become much more affordable. 80% of Americans can find a plan with premiums of $10 a month or less. The problem is that those enhancements run out at the end of this year, and congressional inaction would actually amount to a tax cut. I'm sorry, to a health cut. Allowing the enhanced tax credits to expire would cause premiums to spike, depending on where you live and how old you are, 25 to 300%. And that means that many people who maybe use the healthcare system less than someone with bleeding disorder will drop their coverage. It will be too expensive for them to retain their coverage. And that launches a death spiral. It means that for people with bleeding disorders who will go to any lengths to continue their coverage, the premiums go up and up, and coverage losses mount. Next slide, please. So our asks: no healthcare cuts, no cuts to Medicaid, no extra red tape for Medicaid, and Congress, please extend the enhanced tax credits that make premiums more affordable for people with bleeding disorders and millions of others. Next slide. So those are our three asks: preserve the federal health programs, co-sponsor the Help Copays Act, and reject healthcare cuts. But most importantly, tell your story. Next slide, please. Your story is what will really stick with lawmakers and make an impression, and you are the expert in that story. So as you think about, talking about when you got your diagnosis, where you get care, what your care costs, think about the interconnections between your story and the three asks. If you're a woman with a bleeding disorder, do you have a story about a diagnostic odyssey and how important your HTC was? If you're a person on Medicaid or Marketplace, what does it mean to rely on those sources of coverage and have those sources of coverage available? If you're a family that uses manufacturer copay assistance, what would it mean to you if you couldn't count that towards your costs? And with that, I think we have a minute for questions, if everyone wants to come back online. But thank you. As this says, we can't do it without you, and we're really looking forward to seeing you in Washington.
Thank you, Miriam, and thank you to all of our colleagues at Artemis for your service and for helping everybody prepare for another successful Washington Days. It looks like there's a question about the map, if it's not already included. I'm not sure if it's asking about the congressional districts map in Florida or a map of the Capitol.
It's a map of the copay accumulator states, which if you
that
do,
one. Okay.
either you can reach out to me, but it is also on the All Copays Count Coalition website. Just look up All Copays Count Coalition, and they have a map on that website.
Thank you, Matt. And then I'll turn this one to Artemis. How familiar with CHIP can we expect from our legislators? Depends.
Good question.
Yeah.
Yeah, I think It really depends. Some, like all issues, there are some offices and staff who are going to know everything, and some where you have to start from scratch. And I think you'll just feel that, feel that out as part of the discussion. For the healthcare cuts, lots of groups are talking about these issues, so I would hope offices are familiar with the issues we're raising. But even if it's the first time they're hearing this from you guys, I know you'll kill it. Miriam, Leslie, feel free to chime in.
I would just add that there's almost 60 or more new members of the House of Representatives and at least 10 new members of the Senate, and a lot of times that comes with new fresh staff members, so there may be some more educating to do with a new Congress, but there will certainly also be staff members who are very familiar with these issues.
So we are at time, but I will take a second to answer this last question. Are you expecting us to wear red? You are more than welcome to wear red. A lot of folks who've been there many times have their red tie, their red scarf. I got new red earmuffs in case it's really cold this year. If you want to wear a red accent, you're encouraged to do so. However, we are not providing red ties any longer. But if you're interested, please wear something red. This slide reminds you that if you're planning to come to the Bleeding Disorders Conference in August, which is just outside of Denver, early bird rates end on March 14th. So scan this QR code, get yourself registered so we can see you back again at our largest event of the year at BDC. And with that, I will say thank you again to our sponsors. These are the dates for Washington Days 2026 and 2027. As our stalwart returning advocates, I'm sure you'll want to join us time and again, and you're more than welcome. I want to say thank you all so much for, again, being willing to come to Washington, D.C. and share your experience and for your time and attention during the webinar today. We will see you all on the 5th of March. Have a great weekend. Take care.